Welcome back. Thank you so much for staying with Monday Special, where tonight we're talking about something that's termed as the silent invasion and affects a lot of women, fibroids. And here to shed more light on the issue, of course, is Dr. Bridget Monda. She's a gynecologist. And together we'll be taking your questions and try and cover as much ground as we possibly can within the time span that we have. Please call us on 0719 777. That's 0719 777, or text us on 22422. Leave your name and location. Finally, you can use the hashtag MondaySpecialKE on Twitter. I already have some of your questions. I'll get to them in just a moment. But first, welcome to the show. Thank you so much for coming.
Thank you for having me, Janet.
All right. Let's start with what are fibroids?
Fibroids are non-cancerous growths of the muscle of the uterus. Simply put, that's what they are. I know a lot of people worry about them being cancer, but they're non-cancerous. We have mainly four types. The type that grow outside. If you look at the uterus like a ball, they grow outward. Those are called subserous fibroids. There are those that grow within the muscle. They're called intramural fibroids. Then there are those that are called submucosal, and those are the ones that cause the greatest symptoms. They grow into the cavity of the uterus, and then there's some that grow on a stalk like a fruit, and they're called pedunculated.
All right. Which are the most common types? Is that a question that we can ask?
It's just a way of us trying to position them anatomically, but more often than not they're mixed. So you'll find an intramural fibroid actually growing within the muscle and then extending into the uterine cavity, or within the muscle and extending out. So it's just a way of us describing them anatomically.
How does one know for sure that they have fibroids?
Usually from the symptoms. Now, fibroids can actually be identified right from adolescence to the postmenopausal period. But the reason they seem to be most common between the ages of 40 and 50 is by then they've grown to a size where they can actually cause symptoms.
And yet now we're seeing it with a lot of younger women. Is there a reason? Is it linked maybe to lifestyle? Okay, the actual cause of fibroids, Janet, is not really known, but there is a genetic predisposition to it. So you'll find it's familial. You'll find a lot of, like for example, if my mom had fibroids, it's likely that I would, her sisters would, my daughters would as well. So there's a familial link to it. Then there's a genetic predisposition as well. It's more common in black women than it is in Caucasian women. So for example, if you took a room full of 100 black women, at least 90% of them will have a fibroid of some sort, some size or the other. It's genes. It's again genes. And if you take a group of Caucasian women, the same number, you'll find probably just about 10 out of the 100 would have fibroids. Then lifestyle as well, because it's been shown that women who are a little on the heavier side, the more plus size women, have a high incidence of fibroids than the smaller counterparts. Are fibroids always harmful? No. A fibroid on its own really does not is not the problem, but it's the symptoms that it causes, and then the complications that arise from these symptoms that would then harm your health. Symptoms such as heavy bleeding, that's the commonest. Heavy, painful, prolonged periods. You may get intermenstrual bleeding. You may get lower back pain, lower abdominal pain. You could also get, you see, because the uterus literally sits on top of the bladder, you get frequency of micturition or passing urine all the time. You get constipation as well, but the commonest symptom is excessive, heavy, painful periods. A ballpark figure of how many women it affects in Kenya? You know, we really don't keep our statistics, Janet, very well, so I can't really give you a figure, to be very, very honest, but they're very common. Now, there's a reason. You asked me why do they seem to be very common now. Fibroids tend to grow in an estrogen-rich environment. Our female hormones, particularly estrogen, stimulate their growth. Now, a few decades ago, you'd find that most women would either be pregnant or breastfeeding, so the fibroids really didn't have to grow, didn't have time to grow. But for us now, we're getting our children later, and we're getting them, and then we're getting fewer in number. So the fibroids have a very long time to grow. So that's why the incidence, one of the reasons that the incidence has actually grown. Then of course people are more aware. So when they develop symptoms suggestive of fibroids, they go to hospital. They're diagnosed. We have better health facilities, better diagnostic tools, so they're picked up better and they're reported more. Okay. You know, putting this show together, a lot of women pulled out. They were going to come on screen, and then at the last minute they said,
I can't either. My partner doesn't think it's a good idea. Why is there such a stigma attached to fibroids?
It's more due to lack of information. Because you see, if you don't have information, the right information about something, you're not able to make an informed decision. That's number one. Number two, there's so many myths surrounding fibroids. Traditionally, it was always felt that if a uterus didn't grow a baby, then something else would grow. But we now know it's actually because of hormonal stimulation. And then just misinformation. That's basically it. And then one of the commonest causes of infertility are actually fibroids because of the way they affect the uterus. And you know, infertility, particularly in an African setup, is something that's stigmatized.
Absolutely. Okay, one or two more questions before we go to questions from the public, some on SMS. What if someone becomes pregnant and has fibroids? Can the fibroids lead to difficulty, first of all, in conceiving and lower one's chances of carrying the baby to term?
Fibroids can affect fertility. They are a common cause of infertility because, one, they may occupy space in the uterus and prevent a pregnancy growing. So you get problems like premature labor, or you find because they're occupying space, the baby is not able to turn, and then you get malpresentations or bad presentations like breech presentations. That's one. Two, they can actually just block the tube so that then the sperm is not able to get to the egg, and then you're not able to conceive. You could find that a fibroid within the cavity actually acts like a coil. It prevents implantation of a fertilized egg in the uterine cavity. Or if the egg is fertilized and it implants on top of a fibroid, it's not able to grow, and then you miscarry.
Okay. And can you? But so sometimes it can affect you carrying the baby to full term. Okay.
Yes, but there are very many women who have fibroids, conceive and actually have very healthy babies, have very healthy pregnancies without a problem whatsoever.
Okay. How big can a fibroid grow to, size-wise?
As big as a grapefruit, even bigger sometimes.
So not a basketball like some people think. Is that worst case scenario, or?
They've been quite okay. There's the average size, really, Janet. It could be really bigger. Bigger than I mean, a grapefruit is bigger. Okay. The size of a melon. Let's say.
All right. Let's move to one or two questions. Jerry, she doesn't say where she's writing in from, but she says, Janet, I'm 32 years old. I've never had a baby or used contraceptives. Lately, I've been having very heavy, non-painful menses to the point that my blood level has fallen to 7.2. Could this be fibroids and any risk of not getting a baby in the future?
Okay, now first, one correction. She's mentioned contraceptives. Contraceptives don't cause fibroids. Nobody really knows the cause, number one. Number two, we actually do use contraceptives sometimes to control the bleeding that fibroids do cause. So that's another point.
Okay.
Number three, she hasn't been to a medical practitioner of any sort, so there's no way of telling what the cause of her excessive bleeding and the eventual anemia that she's developed. We really haven't found the cause. Sorry, we really haven't found the cause. So she needs to go in to see a gynecologist to actually have a proper physical examination done, and then a diagnostic, something diagnostic like an ultrasound be done. That's the only way we can actually confirm the cause of her bleeding.
And this goes back to, I guess, what we could call early detection. The fact that people maybe aren't going for checkups as often, but it could be detected early enough, right? If you go for those checkups, whether it's a pap smear or ultrasound, as you mentioned.
The interesting thing, Janet, is that more often than not, the diagnosis of fibroids are actually found incidentally. You go in for a pap smear, routine checkup, or for something totally different, and then a pelvic scan is done and you discover you have fibroids. A lot of times it's like that. Then you have those women who actually do develop symptoms, and then you go in and then we investigate and find that you do have fibroids.
Okay.
So it's always, I mean, it's based purely on the individual.
All right. Nancy in Nairobi asked, what's the difference between adenomyosis and fibroids?
Now, the lining of the uterus is called the endometrium, and it's found within the cavity of the uterus. Sometimes it grows in the wrong places. So if it grows into the line, into the muscle of the uterus, it's called adenomyosis. When it grows outside the uterine cavity, it's called endometriosis. So that's the same disease in different forms. And that has absolutely nothing to do with fibroids, because fibroids are non-cancerous growths of the muscle of the uterus. Adenomyosis is abnormal growth of the lining of the uterus that grows into the muscle of the uterus.
All right.
So they're totally different.
They're totally different. We're ready to take a call now. If my director can remind me, Peter from Uziro is on the line. Peter, what's your question?
My question is, okay, my wife is having that problem of those fibroids. So, hello.
Yes, your wife has spoken, yes?
My question is...
Yeah. Yes, Peter, go on. What's your question?
Yeah. So how can we be treated, that one?
Okay, how can they be treated?
Can it...
All right. Thank you for that.
How can it be treated? Can it affect the pregnancy?
Okay. Thank you so much for that, Peter. I think in terms of pregnancy, we've talked about that. But treatment for fibroids?
Treatment is individualized.
Yeah.
It depends on the patient's age. It depends on whether they've attained their desired family size. It depends on the size, the symptom, and the position of those fibroids, and whether that patient is a good candidate for surgery or not.
Okay.
So it's purely individualized. If it's a woman who's postmenopausal, really, we won't hurry to go and remove the fibroids, because remember, fibroids grow in an estrogen-rich environment. After menopause, you have very low estrogen levels in the body, so they tend to shrink. They may become calcified and cause what we call womb stones, which may cause pelvic pain. Then we may go in and remove them surgically.
Okay.
Now, when it comes to women of reproductive age, there's a medical treatment and then there's a surgical treatment. When we talk about medical treatment, we're talking about controlling the pain, controlling the bleeding, and then there are other hormonal treatments that we give sometimes when the fibroids are really big, to help those fibroids shrink, to allow us to be able to remove them easily. But what a lot of people don't know is that these hormonal treatments are a temporary solution.
Right.
We are just trying to make a bad situation easier to deal with, because immediately you stop the hormonal treatments, those fibroids grow back to the original size within 3 months. Now, the absolute cure for fibroids is actually removal of the fibroids, which is surgically.
Okay.
And depending on the woman's age, like I've mentioned, like he's talking about pregnancy, so I'm assuming she's within the reproductive age, she'd want to have children, she hasn't had a desired family size yet. We will do what we call a myomectomy, which is removing the fibroid itself and leaving the uterus intact. If you don't need your uterus anymore, you've had the number of children that you like, then we can remove the uterus itself, including the fibroid. There are other more specialized treatments like what we call uterine fibroid embolization, where we actually block the blood supply to the fibroid itself, and then it degenerates, eventually shrinks and dies.
Okay, all right. So we'll recap some of that a little later on. We need to move on to Grace from Kajiado. Grace, what's your question, please? Hello, Grace?
Hello.
Hello, Grace. Yes, you're live on the air. Yes?
I'm calling from Kajiado.
Okay.
I have been somehow like a controlling my
Okay.
Hello.
Hello, Grace. Please move away from the television and reduce the volume so that we can hear your question. I think we're struggling to get a hold of, to hear Grace very clearly. I don't know whether we can drop the call and get that again. Okay, my director says we'll try and get that again. But here's something I want to ask around myths and facts. So I'll read it to you. You can tell me if it's a myth or a fact.
Okay.
The rise in female employment may also play a factor in women developing fibroids. Traveling around, today's women are more ambitious, which means later marriages and pregnancies, if at all. Traveling in different environments can affect a woman's hormones. I think you touched on it, but is that a myth or a fact?
That's a myth.
It's a myth.
Yes.
Okay.
That's not factual at all.
Yeah. All right. Another myth is, and I think you've answered this. One factor it's linked to the rise of fibroids is obesity, and more than 40% of Kenyan women are now classed as clinically obese. This is truth, I guess. I think you talked about this being.
Well, there is an increase in obesity, but about the statistics, I wouldn't be able to give you the correct ones, Janet, because I don't have them. But I mean, we're definitely seeing a lot more plus-size women. Who are obese. But then, you know, we also need to know to note something, Janet. African women tend to be bigger. We've got bigger bones. We've got bigger muscles. It's genetically we're that way. We've always been that way. So. We are bigger anyway. We are bigger anyway. So
more prone.
No, I don't think so. That is now purely genetic.
Okay.
That's purely genetic.
And you touched on that.
Because you can get a woman who's size 0 women with fibroids.
Okay.
It's not a hard and fast rule. It's just the average.
The average.
Yeah, common things happen more commonly.
All right. We have some questions now on Twitter that we're going to through to our expert in studio tonight, Dr. Bridget Monda. Let's take a look at your tweets. I've never seen a skinny person with fibroids. Ask the doctor if we've got any relation between body size and fibroids, which I think she's answered, but we'll go back to it. What measures can we as young parents take to help prevent fibroids in future? And then we have, what are the long-term effects in case you do not seek immediate medication? I hope we're not moving too fast to these questions, doctor. Okay. And do traditional medicines help in healing fibroids? I hope we'll remember a lot of these questions. All right. Is there any other way apart from hysterectomy that can prevent fibroids from coming back? And finally, what is the management of symptomatic my eyesight from here is pretty bad. So let's move and ask, can you see that?
Yes, Anika's fibroids.
Okay. A desire for fertility. Those were quite a number of tweets. Let's see if we can just take those for now. Oh, here's the last one. I've never used contraceptives. I was diagnosed with fibroids. I read about laser treatment. Any leads? That's a lot of questions. The ones you can remember.
I'll try and remember. Answer the ones I can remember. Now, I've said this already. Contraceptives do not cause fibroids.
Okay.
Fibroids are non-cancerous growths of the muscles of the uterine muscle. We even use contraceptives in trying to manage and control the bleeding and the pain that are caused by fibroids. That's one. Now, somebody mentioned about traditional medicine. Who uses conventional, the regular medicine, we hesitate to use traditional medicine because we don't know the contents of a lot of these traditional medicines, which are usually herbal. We don't know the concentrations. We don't know one what is in them, and two, even if we do know what's in them, we don't know the concentrations. There's no way of knowing the right dose and the long-term effects of it.
Okay.
So we tend to avoid using traditional medicine as compared to using conventional medicine.
Right.
Now, about laser treatment, it's something that is actually, well, it's done, but we don't have it available here in Kenya so far. What we have available when it comes to surgical treatments is what I'd already mentioned, myomectomies, where we remove the fibroids themselves, either total removal of the uterus through a total abdominal hysterectomy, or uterine fibroid embolization, where we block the blood supply of the fibroid, and that eventually makes it eventually shrink. There are new treatments like laser, like what she has mentioned, but we don't have them yet. It's actually just using a laser to literally zap the fibroid.
Yeah. But we don't have that available.
We don't have that, to zap it and, make it shrink and die off.
Yeah, and I know someone talked about size, and I think you mentioned that. She said she's never heard of skinny people necessarily having fibroids.
Common things happen more commonly. But remember, fibroids can occur in first of all, let me go back to the genetic predisposition. Black women are more predisposed to getting fibroids than white women. It's a genetic predisposition. There's nothing we can do about it. Size doesn't always count. Yes, they're more common in women who are obese, so tend to be more on the plus size. But it doesn't mean if you're a size 0, you'll never have fibroids. There are very many very skinny women who do have fibroids.
Which you mentioned. Someone else asked, and I think you touched on it, but just for the sake of answering the question, the effect of not treating fibroids. I think that's what they said, if you leave them untreated. And I think you touched on it, but just repeat it.
More often than not, we will treat fibroids when they cause symptoms. A lot of women go through their lifetime having fibroids and never knowing, one, that they do have them, and never having symptoms. So there's no reason to treat them whatsoever. More often than not, they're discovered either incidentally when you've gone in to see the doctor for something totally different, and then, we do a pelvic scan and find that you do have fibroids, or the fibroids do become symptomatic. And remember what I told you, Janet, initially, the commonest symptom is abnormal uterine bleeding, excessive periods, excessive, painful, prolonged periods. And then you can get pelvic pain, you can low abdominal pain, you can get back pain, you can get frequency in urination as well, you can get constipation because of the pressure effects.
What about sporadic periods? Could that be?
What we call intermenstrual bleeding. You can get your period prolonged, and then the period stops, and then you get bleeding in between. That can happen as well. And one of the reasons the fibroids actually do that is they interfere with the contraction of the uterus when you're having your periods. So that muscle is relaxed instead of contracting to control the bleeding, and then you bleed because of that.
All right. Another question here is, can fibroids come back after treatment?
Fine. We may remove the fibroids, but remember, Janet, the potential is still there. So even if we did go in and do a myomectomy, we remove all the fibroids that we can possibly feel and see. But if the small fibroids are still there and we're not able to remove them, or the potential, remember, is still there, so long as the uterus is there and it's in an estrogen-rich environment and you're predisposed to them, they can grow back.
All right.
Yeah.
Before we take another question on SMS, we have Dominic, again, calling in from Kajiado. Dominic, what's your question, please?
I just wanted to know whether the child there can treat a patient who has a blocked tube, so she can get, and conceive.
I'm sorry, Dominic, could you please repeat your question? Oh, yes, what about blocked fallopian tubes?
Yes, I just wanted to know whether the gynecologist there can be able to treat a patient with who has one blocked tube, because it's like it's related to the fibroid.
Okay, if my director can guide me on that question, because I'm not getting it. Okay. Whether blocked fallopian tubes can be a cause of fibroids or a symptom of fibroids.
Fibroids can grow in a position where they do block the fallopian tubes. But then blocked fallopian tubes, more often than not, when we're discussing blocked fallopian tubes, we're talking about infertility. So there are very many different causes of infertility. The commonest cause of infertility in this part of the world is actually sexually transmitted infections, mainly chlamydia and gonorrhea. Yeah.
All right.
So that has nothing to do with the fibroids. But fibroids actually can cause, they actually can block the fallopian tubes purely because of their position.
Which is what you mentioned, I think, earlier in the show. Can I develop fibroids after I've had a child?
Yes, you can.
Yeah.
So long as the potential is there, you can.
Okay. Then we have, this is Levina from Kisumu says, I have a problem. I got married with a child. My daughter is now 12. After that, I haven't gotten any other child. I've gone to so many doctors and they've told me that I have ovarian cysts. Some have told me that I have fibroids. And then she goes on to a more personal level saying how it's affected her marriage. You know, which is unfortunate. So take us through ovarian cysts. So she's been told ovarian cysts and then she's been told fibroids. What can you say about that?
Now, fibroids, remember, grow in the uterus.
Yeah.
The ovaries are where we store our eggs, where we're born with our store of eggs, and that's where our female hormones, estrogen and progesterone, are secreted. Those are two totally different organs. Okay. So that's one. Now, two, a cyst is a fluid-filled cavity. All our eggs in the ovary develop in those fluid-filled cavities. Now, we can have normal cysts, like what I've mentioned, where our eggs develop, and then we can have the abnormal cysts. Those abnormal cysts can either be cancerous or non-cancerous. So that's a totally different ball game. They have absolutely nothing to do with fibroids, but they can occur together.
All right.
Yeah.
All right. Okay, we have another phone call, Immaculate. If you can please ask your question.
Yes, how are you?
I'm good, Immaculate. Thank you for calling Monday Special. What's your question?
Okay, I was asking, after the treatment, after that hormonal treatment, can it affect your childbearing ability?
After the hormonal treatment?
Yes, can it affect your childbearing ability?
Okay.
Now, I'm assuming she's talking about the hormonal treatments we give to shrink the size of the fibroids. Remember, we're giving those hormones to shrink the size of the fibroids because we're going to go in and remove them surgically. So, if the cause of this woman not conceiving, her infertility, is the fibroids, then she should be able to conceive after that.
Okay.
Yeah.
She should
because
be able
all we're doing about the hormones, by the way, all we're doing with the hormones is shrinking the size of those hormones. Once the job is done, the body metabolizes those hormones and they're excreted from the body.
Okay.
Yeah.
All right. I think we've sort of run out of time, but what would you want to say? I know there's a lot of women, and we talked about the stigma, and you talked about the lack of education, but sort of, apparently we have a last phone call before we wind up. Is it Carol? Carol is on the line. Carol, where are you calling from and what's your question?
My name is Carol.
Yeah.
And I'm calling from Kitsuru.
Okay.
So, like, I wanted to ask, I use contraceptives lately.
Yeah.
And I have some pain. I after I stopped using the contraceptives, I used to have pains on my pelvic and on my...
Carol, please turn down the volume on your television. Okay, are you still there?
Sorry?
Please turn down the volume on your television set.
I'm saying?
Yes.
Hello. After I stopped using the contraceptives,
yeah,
I had some pains on my fallopian tube. So my question is there any relationship between that and the fibroids?
Okay. All right. If I heard Carol correctly, she stopped using the contraceptives and started feeling pains, I think, in her pelvic area. And is there any link? I know you've talked a lot about there's no link between contraceptives and fibroids, but maybe just comment on that.
I can't say that
enough.
Enough.
I think it's a very common myth then. I think a lot of people feel like family planning equals the possibility of...
Yeah, no, and that is totally untrue, because we actually do use contraceptives to control the bleeding and pain caused by fibroids. So they're totally unrelated, okay? They're totally unrelated. So that is one take-home message. Contraceptives, the hormonal contraceptives we use especially, do not cause fibroids. We even use them in management of the symptoms caused by fibroids and signs. That's number one. Number two, being diagnosed to have fibroids is not a death sentence. They are non-cancerous growths of the muscle of the uterus, and there's help. What you just need to do is, when you develop symptoms, just go in, see a gynecologist, be properly examined, diagnosed, and have the proper treatment given to you.
Okay. Yeah. All right. Is there anywhere that people can, I mean, other than obviously on the web, where people can just get access to more information on fibroids? Is there a particular maybe site or...
Okay. Well, Dr. Google.
Yeah, Dr. Google is everyone's best friend.
Dr. Google, any medical practitioner really. Go to your hospitals, the gynecologist. Okay. Yeah. The information is all out there.
There's requests to ask where you practice, whether you're at liberty to say that on air.
Well, it's really up to you, Janet. May I?
Please, yes.
Okay. One, I'm a lecturer at the University of the Kenyatta University School of Medicine. Okay. And then I have my private practice at the KMA Center, second floor, room 213. Okay. You can give my phone number later after the show. Okay. Yeah.
If you're prepared for the flood.
I'm fine.
You're fine.
I'm okay with it.
You can. I think we'll take it from here. Then when we're winding up, we'll scroll it. But we've been asked to tell you to say your phone number.
Oh, okay. I have two phone numbers. It's 0733 77 9926 and 0717 77 9926.
All right.
It's the same number.
Okay, if you could say that one more time.
One more time, okay. 0733 77 9926 and 0717 77 9926.
All right, fine. Yeah. Thank you so much for shedding light on this, huge topic, and we've been meaning to have it, but like we said, women do keep pulling out for one reason or the other. Now we understand why, but we appreciate that very much. Dr. Bridget Monda, of course, and we're going to take another short break, and then Hussein Mohammed will come on set for us to wind up.